Welcome to the Trusted Dentist Podcast, the channel where we talk all things dental and answer the questions most people do not want to or are afraid to ask their own dentist. Hi, my name's Dr. Ved Barani, and joining me today is Mariah, who's going to be asking me all the questions. And today's episode is really about broken to confident, real patient transformations.
Thank you, Dr. Ved. So my first question would be, are there any transformations that really stand out to you?
Yes, I have been very fortunate, Mariah, in my career to be able to do treatments that actually make a huge difference. One of the most recent ones that stand out is a gentleman I treated for dental implants where he had been a smoker for over 30 years. He worked in an environment in a factory where all of his co-workers were smokers as well. So there was very little impetus to give up. Unfortunately, because of that, he was suffering general ill health as well as his oral condition had deteriorated. He had several broken teeth, advanced gum disease, bone loss in his mouth, and unfortunately, he was suffering from poor relationships at home as well for that reason. When he first saw me 2 years ago, he did realize he needed something drastic and dramatic done. However, the treatment was overwhelming, both from a process perspective and financial perspective. Over time, we tried a lot of things like remove some of the infected teeth, which he endured in the chair in spite of his phobia and anxiety, and made him dentures. However, none of that was really working for him. Finally, about 4 months ago, he made the decision and took the step forward where, under general anesthetic, we treated him. We removed all the infected teeth in one go. We cleaned up the jawbone. We shaped it and placed 4 to 6 implants in his upper jaw and another 4 and 6 implants into his lower jaw. And we made him what we call as teeth in a day, as a first set of temporary teeth that he could wear. The joy in his eyes was just irreplaceable. I mean, you can't pay me enough to be able to do this for him because he just looked around and he had tears in his eyes and he walked out with a promise he won't smoke. Recently, I saw him about a month ago to change over his temporary sets to permanent ones which are stronger and titanium reinforced. We finally finished his treatment and he turned around and told me he hasn't touched a cigarette for 44 months, which is almost like 160 days, right? And that was the moment I knew he's a winner. He said he's feeling better, he's eating better, he doesn't have all those pains and aches anymore. And his wife is really happy with him and they're planning a vacation after 8 or 9 years of the marriage, which is just remarkable. So that is one journey which is just incredible.
Yes, that is incredible. A smile really is priceless. Do you have any other stories of how dental confidence has impacted somebody's life day to day?
Yeah. Look, one of the story that I remember is of a patient who saw me where she was suffering from what we call as a gummy smile, and that had been with her in her school days and had carried forward into her college life and then into her workplace as well. She was in her mid-30s. When she was talking to me, she was barely even moving her lips because every time she used to even smile a little bit, she used to show a lot of her gums, and that was the psychological scar that she was carrying on for such a long time. After careful assessment, we did some minimal treatment, what we call as gum lift with a laser, with the help of a specialist periodontist involved in the procedure, and with some minimal amount of resin bonding, we got her teeth white with teeth whitening and a little bit of periodontal plastic surgery, and she couldn't believe how that beautiful, how the transformation actually was incredible in terms of minimal treatment. She's smiling again. She, has a lot more confidence now at workplace, and she told me that this was the best thing she ever did in her life for herself. So incredibly happy and very proud of her for taking that step.
Yeah, wow. So would you say possibly that the emotional impact might even be stronger than the physical impact?
Oh, 100%. The number of times we find patients that see us where they have tried so many things that can change their the way they look at the world. Now, when we look at someone, we normally always make eye contact. And one of the things that really stand out is the area between the bottom of your nose and above your chin. This is a crucial zone because that actually reflects a part of your personality, the color of the teeth, the shape of the teeth, the position of the teeth. If all these things add up to your entire smile. And by making even a few changes here and there can have a huge impact on the overall.
So, with that in mind, why do you think so many people wait so long to get this life changing treatment?
Well, a lot of that is psychologic. The fear of the unknown, as we call in dental world. A lot of people have anxiety around dental treatments because they've had other people who've done something and they've had a bad experience. And that's, I think, the number one reason why people keep putting it off. The second factor is, again, having a trusted professional who would give you the right advice. Sometimes professionals don't give advice in terms of what's best for the patient. And from our point of view, we need to make sure that we give patients a lot of options. Options give them the ability to assess what's right for them, what the pros and cons of each are, and what the risks are. Once they have all the information and they're educated enough, they are more empowered to make the right decision for themselves. And that's the process that we follow here.
So, there's probably some younger listeners who are going through a bit of fear, a bit of anxiety about not only going to the dentist, but maybe showing their teeth in prom or whatever the equivalent is. I'm Canadian, whatever the equivalent is here in Australia. Do you have any transformational stories of that situation?
Yeah, look, absolutely, Mariah. I have one of my very young patients who saw me when she was 16 years old. Unfortunately for her, due to earlier medical issues when she was younger, she had what we call as a developmental defect in her enamel. What that ended up doing is that it made the enamel quite soft and brownish in color, and that was a big, big factor for her. Also, the size of the teeth was much smaller, so compared to the entire face. So being a young person, we were very aware that any treatments we do now have to last her for a very, very long period of time in her life, right? So we ended up going through a specialist orthodontist. We got the teeth in the right position, which took almost, from memory, about 14 months. She came back to us. We did what we call it some smile design and a mock up for her. And she had a mom who was very supportive, which is and a grandmother as well who came along with her. And through that journey, we did some veneers for her because all she wanted was to have a beautiful smile for her year 12 social, which is the equivalent of a prom here in
Mhm.
Australia. And she we literally finished her treatment 2 weeks before, and both the grandmother and the mother were with her. And even talking right now about this is making my hair stand. She was just in tears and she just couldn't believe how beautiful she looked. She was a beautiful person. I mean, I can't imagine a younger person with that beautiful personality. And just having that smile was like completely transformative for her. So she went to her year 12 social, took a lot of pictures, and her mom came back and showed them to me and thanked us for doing what we could. And like I said, very fortunate and blessed to be able to provide this.
That is a beautiful, beautiful story and very inspiring. What do you think holds people back from starting or even just walking into the dental office to begin with?
Yeah. I think currently a lot of people are swayed by what they see on social media. And when they see things that look instantaneous, when they see things that have been transformed in a matter of only a few days, it can create a very wrong notion in the mind, right? And often when they go to the dentist and when they have offered a treatment that may take, say, 12 months, for example, Invisalign, or for example, dental veneers that might take 2 or 3 months to execute from start to finish, that kind of process is hard to then able to digest. Again, the costs of all these treatments and the complications are never portrayed on social media. As a matter of fact, very little is said about what happens behind the scene. So in a dental office, patients need to have a professional who takes them through an educative process of understanding what the little steps are and what they might expect in the end. The good thing is digital dentistry now can do that. We have a lot of ways we can assess what the final result can be, and then we can backtrack to where we want to be, where we are now, and what the steps might be as well. So really putting your trust in a dental professional and then making sure they have the right kind of experience to deliver the treatment is absolutely crucial to making a decision.
Definitely. And as someone who has gone through braces and then Invisalign 10 years later, it is life-changing. I was very ashamed of my smile, and I'm very not ashamed of my smile now. So with that in mind, what would you say to somebody who feels embarrassed about their teeth?
Yeah. I would say it's don't blame yourself for it. It is this problem is something that is developed because of so many other factors in your life. It could have been the bad experience, it could have been the lack of social safety and community when you were younger, but that is not a reflection on you. What is important is that you are aware of it now and you want to do something about it. It is super important in this sense to have talks with some psychologists. There are quite a few psychologists who work around these kind of things. The other thing is the phobia that comes around dentistry is also not uncommon, and sometimes having a good chat with a dental professional who's ready to listen and give you that empathy is also very important. So finding a good dental professional who has the right demeanor, the right kind of attitude towards treating his patients, and also has time to give you is super, super important.
All very good advice, Dr. Ved. Thank you so much. That's all the questions I have for you today.
Wonderful. Thank you, Mariah. If you're on a journey to improving your smile, take your time and ask the right questions. And always seek understanding before making a decision. Because the best decisions are informed ones. If this episode has helped you in any way, share it with someone who might need it.
This podcast is for entertainment purposes only and should not be taken as medical advice. Before making any treatment decisions, please seek independent medical advice.